question to you is, where do you get your health care? Because that is the key point, and why we were founded in 1998. Because we realized that this might be the birthplace of American music, but it was also an early grave to anybody who was a practitioner of our music. And so while we love to go to jazz funerals, the anthropologist in me was going, why did this musician have to die? These were things that could have been prevented, they could have been treated, and yet we're all coming out to celebrate their life. Why weren't we keeping them alive? And I felt, as an anthropologist, there's no way I could do anything to change that. But thanks to Fish, when they played a jazz fest many years ago, the keyboard player's father is a well-known doctor who had created Volunteers in Medicine all over the United States. And he loves New Orleans music, and he knows one song only, and he's really good at it. So Fish invited Dr. Jack McConnell to come to the stage at Jazz Fest and play Won't You Come Home, Bill Bailey. And that is how we got founded. Because while he was there looking at all the Trustafarians out in the audience, grooving to Fish, he thought, we've got to do something to keep music alive in New Orleans. And he lives on Hilton Head, South Carolina, and he had the epiphany, but not the wherewithal to do anything. So he just coincidentally was at a party that summer, and somebody said, oh, you should meet Sybil Moriel. Her son's the mayor of New Orleans. And so Jack went over and said, Mrs. Moriel, I want to save the musicians of New Orleans. I think there ought to be a healthcare center in New Orleans that actually treats the creators of American music. And so she said, well, why don't you come to New Orleans and I'll introduce you to some people. So she took him to introduce the chancellor. He met the chancellor of LSU, who was Dr. Merv Trail, who was also very involved in tourism. And my husband, who worked in not-for-profit healthcare with the Daughters of Charity, and also was on the board of the Jazz and Heritage Foundation. And they got the idea, why don't we create this musicians clinic? Now, I'm going to leave that part of the story there, because we did get founded, and we did produce a CD and whatever. But to be honest, before Katrina, our clinic was underwhelmed with musicians. The people that we did see were tragic cases of musicians who had had no health care their whole lives. And the minute we got founded, they would come, and they were in the last stages of just horrible things. So it was, the clinic was there, and we were struggling, and we never knew from 1 month to the next if we were going to be able to keep going. But then after Katrina, we lost our bank account, we lost all of our patients, we lost our staff, and we lost our clinic. And there was a point in which, as we all can think back to where we were during the aftermath of Katrina, that I thought, I cannot go back to New York and keep writing and keep working in New York. I'm going to quit what I do, and I'm going to go back, and I will borrow the money, and I will get the clinic started again until someone comes along like FEMA and the Red Cross, because they'll know what to do. And as you can see, I'm still running the clinic now. And we have 2,400 patients now, and we have a staff of 14. And we are 7 months away from becoming a federally designated patient-centered medical home. Why we are doing this, I will tell you, because this is what I want all of you to know. What is going on in healthcare in Louisiana right now is absolutely worse than any third world country. And if you wonder why you don't hear anything about it, I'll tell you why you don't hear anything about it. Because our governor is very secretive. He has replaced everybody on the board of governors at LSU who would have any say-so over the medical school. There is not one department head in the medical school who can see what's happening that can speak out, because they are all working for the state of Louisiana. If you wonder why I'm the clinic director that speaks out, it's because I have no credentials to do what I do whatsoever. Nobody can question my degree or my license or prohibit me from seeing patients, because I don't see patients. What I do is I raise the money and bring in the best staff in the world. I'm also this year the co-program chairman for International Performing Arts Medicine Association. And so I have amazing resources in Canada, England, Ireland, Australia. Those are the countries where the arts have been funded by the government for a long time, as well as the healthcare. So the research is there about what occupational illness is, what we can prevent. And so, as you know, we have an initiative called Safe Sounds about making people mindful of hearing loss related to your occupation. You might have hearing loss because you're a bartender, because the club is so loud. Now, everybody can download a free app to know what the decibel levels are that you're in. I mean, you can have that. And be mindful of what it is. So part of what we do is making people mindful of the choices they can make to prevent death by lifestyle or in their careers. And the other thing we do is say to people, be aware of what is happening to the healthcare resources of this state. My husband and I always said we didn't know in our professional lifetime if there would ever be a public hospital system again. Now we question if in our physical lifetime there will be. The big public hospital that everybody says is going to be opened and is going to be accessible, they are in the process now of giving it away. It is not going to be a public hospital. There's a program that we are part of now that will end in December that allows anybody under a certain level of poverty to get Medicaid. Now that might seem really boring to you about why you want Medicaid. It would allow you under the new Obamacare to be covered, that your health care cost would be covered. You would be treated as an insured person. Our governor is denying that anybody can get federal funding for Obamacare.
I just wanted to say that program actually helped our family last year. My husband had a bad infection in his legs, and because of that program, he has his legs. He was able to, it paid for the hospital bills. I mean,
right.
You know.
It's an awesome program, and so I have enrollment forms here, and I have information about the clinic. But come December, our roads are going to be closed, because we don't know how we're going to pay for the health care services that we need to provide, that we feel are necessary. I don't care, we're not like Blue Cross that says, oh, colonoscopies aren't important. We pay for dental care, we pay for colonoscopies, we do what we believe is the right thing to do for our patients. And it is more about informing the voters in the state and decision makers in the state that something is really, really wrong. And these doors are closing. And as you say, GNOCHC was really important to your family. That program ends in December. And because Jindal is saying no Medicaid funding federally, we're gathering our nuts for the winter is basically what we're doing, because we just don't know how long we will be able to do what we do. And as the public hospitals are being closed, and as the other clinics that depend on this GNOCHC funding are going to lose staff, in our organization, we say we put the cult back in culture. So we're not going to be
yes, indeed.
We're not going to be losing staff. I can promise you that. We're fighters to the end. But that said, I am very fearful, and I think this is going to be a reality, that some of the other public clinics that our community depends on are going to close. And I'm meeting on Monday with the Daughters of Charity, which is a very vibrant, wonderful community health system, to ask them if they will partner to us to create a New Orleans Musicians Clinic Junior. Because I feel like that these young musicians, and think about everybody in a marching band, should be able to have access to both comprehensive medicine and occupational health care from the time they pick up an instrument. And I think the same thing for the young girls who were in ballet. I mean, the data is out there. The research is out there about how to prevent injury, how to help young musicians understand about performance anxiety. There's so much out there, and we just want to make ourselves a resource to partner with everybody so that we have the healthiest arts community in the U.S.
I just want to say that every kid in my program, well, they can't treat the kids because they're minors, but they can't treat them yet. They can treat all of their families, which is an amazing, amazing resource. Also, a lot of my teaching artists don't have health care. So they are so grateful to be able to go to the clinic. And I mean, their services are so expansive, and it's really incredible. And I can't imagine New Orleans without this resource.
And that program would be the youth orchestra of the lower Ninth Ward.
Does anybody have any questions? We have a website that we have a paperless policy at our clinic, and so we try to keep it very up to date. New Orleans Musicians Clinic. Hi.
Other governors have peeled over on this resistance to federal Medicaid.
Wouldn't that be wonderful if ours would?
Well, Arizona's a very right-wing state, and it did. So what can people do to encourage this? Because I think eventually, Louisiana will probably get on it.
I think that
They might.
the more that Jindal sees that he will lose support in Louisiana, and that people are aware of what he's doing, I think that's the only hope we have. I know that religious leaders have gone and talked to him, and that's what's helped with other governors in other states. That the religious leaders said, you know, how can you morally do this? But so far Jindal has said no. So I think that public opinion is the only thing you've got. And I know that the Times-Picayune has done their best, but because everything is done in secret, it's really hard to write an article when.
Plus the Picayune only going 3 days a week now.
Oh, I know. It's hard, but I mean,
there's no depth of reporting coming from that direction anymore, unfortunately.
I'll tell you a story that this fall I got a call from the Associated Press, and they said, did you know that Jindal and some of his top aides have these illegal email accounts, and your name is all over them? Do you have a comment? And I said, well, what did he say? And they said, oh, well, he just talks about you all the time because you and your husband spoke out, and you put stuff on your website, and he's really mad. I said, well, I'll be making my statement at Crew de Vue. Just come to the parade.
Excellent.
So that was my comment. I am not talking about this because I don't want him to take our clinic out.
Yeah.
So, anyway, here is information if you have friends who are eligible. We treat audio engineers, we treat writers, actors. Just please, if you know somebody who'd like to be a patient, and tell them it's now or never. Thanks.
Thank you, Bethany.
Thank you.